Hey ladies, in the spirit of the new year, my dears, I said that we would get a lot of informational videos, and so it begins. Okay, so for anybody who does not know, if you happen to stumble across this video and you're not one of my followers, my name is Dr. Tosha Rogers. I'm a board certified OBGYN in Atlanta, and I jump on all the time to give the medicine real in layman's terms so that you can understand and you get the real tea. Okay, so I think today what I want to talk about is UTIs with respect to women and our stuff and all the good stuff. So when we talk about UTIs, we're talking about urinary tract infections. The infection can be, usually in your bladder, and what we call a little pee-pee hole, the urethra. And people have really gotten to a point where it's like, oh, I'm going to pee after sex because if I don't, I'll have a UTI. And it's possible because at the end of the day, anything that gets on that pee-pee hole, which sits right above the vagina, yes, girl, she can have discharge, she can have semen, it can be all of the things, and you yourself can have a bacterial infection and may or may not know it. That can travel up your urethra and cause infection. So peeing or cleaning off that area after sex, absolutely recommended. Absolutely. And that's one of the things that we know. People always say cranberry juice. Well, it's not anything against cranberry juice. Let me be clear, ladies, but there is, I can't even recall the compound, but there's a compound that's actually within cranberries that is supposed to be good for your bladder. And the amount of it is so minute that for you to actually have a benefit from the cranberry juice, you'd have to drink so much cranberry juice, and it'd be pure cranberry juice. It's not the Ocean Spray. Shout out to Ocean Spray though, but it's not the Ocean Spray cranberry. No, that's not what we're looking for. We're looking for the pure cranberries, super tart. You might as well juice some cranberries and a whole lot of them in order to get the benefit. The best way to actually keep your bladder healthy is water. I don't know, it's like a lot of videos are going around and stuff. It's like, oh, you got to drink this drink and you got to drink that drink and a whole other drink. No, water. Water is always good. Alkaline water, unless you have a water restriction. And that's my girlies with kidney issues, or you have cardiac issues, or any other medical issue that puts you with a water restriction. Honey, water is good for the things. Water is good for that vagina. Water is good for the skin. Water is good for your bladder. Water is good for your weight. Water is that girl. So please don't discount drinking water because it is important. And whoever is trying to kill everybody and talking about salt water, no, please, Lord have mercy, please don't. Just water, just basic water. Like, we're doing too much these days, just basic water, okay? Another thing that I'm seeing when I check, when patients come in and say, oh, I think I have a urinary tract infection, even if I dip your urine, and I see that, yes, you may have a urinary tract infection, can I tell you, I still send it off to the lab. And the reason is because I'm curious as to what caused your infection. Not just that you have a urinary tract infection. The question is, what has caused your infection, right? So I usually get, interestingly enough, do y'all know the bugs? And I call them bugs. But do you know all the things that are in the urine that usually cause urinary tract infection? It is the bacteria that comes from feces. I said it. If you don't know what feces means, that's poop. That's number 2. Okay. And it's really interesting because I had to ask myself a lot, because I tell patients you are supposed to wipe from front to back. You're not supposed to wipe from back to front. You wipe the vagina from the front of it to the back of it. Okay. You're not supposed to wipe your booty from the back to the front. You wipe that from the front to the back as well. Everything goes from front to back to keep things away from your bladder, because your bladder is actually sterile. Inside your bladder is sterile. So we want to keep that from getting infected, right? And so, no, I'm wiping, and I believe it. And if you know me, you know I tell you never to use baby wipes. You can use water wipes, which is the same as kind of a baby wipe with just no soaps and detergents on it. So you can use water wipes, but women are using those and still getting, and here's what in my mind, because I have an analytical mind. I'm a chemist by trade and, well, by my undergrad degree. And And here's what I'm thinking. A lot of women wear thongs and things like that. So as much as you guys think that you're wiping well, you're clearing the area, when you guys put those thongs in and you're moving your thongs back and forth and back, and stuff is just happening. And then also too, please be mindful that, remember I told you before, with detergents, a lot of times these detergents are not clearing the bacteria, the poop, the mold, the blood, the yeast, the vaginitis. It's not clearing it in your panties. Yes, it's a plug for Clean and Cute, because we do what we say we're going to do, and that's we keep those panties nice and clean. But at the end of the day, make sure you're changing out your panties every 6 months or so. Make sure you're being very clear that you're wiping well enough and you're following with the water wipe if that's necessary. But please don't be super fixated on flooding your kidneys with cranberry juice, because oftentimes you're just flooding it with sugar. And so water. Make sure you are urinating and clearing the area with a washcloth or some soap and water immediately after intercourse. And then make sure that we are wiping the proper way in the proper direction. And yeah, so that's pretty much it when it comes to urinary tract infections. Okay, guys, it was a pleasure talking to you. And again, drtosharogers.com. If you want a private consult, it's askdrtasha.com. Have a great day.